you, and this forum is going to focus on mental health conditions. This is a very, very important forum for our community in many, many ways, so I thank you all for being here. What you're going to hear about today is a few things. You're going to hear some incredibly powerful speakers this morning, and you're going to hear about stigma as well. We're also going to hear from Roger Charney to talk to us about some of the statistics of mental health, as well as hearing from psych emergency services, so you know what to do if you have an emergency. We'll be talking about the campaign to change direction, which is an anti-stigma campaign, but this campaign works perfectly in conjunction with other anti-stigma campaigns, and it actually can help strengthen them. So we're very excited about today and very happy that you're here. As I look around the room, we have so many community leaders here and so many VIPs that instead of me pointing everybody out, I'm going to have you introduce yourselves. I am Carol Novert. I am the Administrator for Health and Human Services for Sussex County. Freeholder?
Sylvia Patillo, freeholder.
Good morning, everyone. My name is Annalise Malgiri. The sash and crown I don't wear on a daily basis. I am Miss Gateway for the Miss America organization, which we'll talk about a little bit more.
Good morning, I'm Joan Russo, the Social Service Director.
Good morning, I'm McDonald, County Health Officer.
Jane Rose, Division of Health.
Christine Florio, Sussex County Division of Community and Youth Services.
I am Tamara Contreras, Community Organizer for the Forward Franklin Alliance.
Bob Covey, co-facilitator, PTSD Connections Group with NAMI Sussex.
Annie Blinn, NAMI Sussex.
Jerry Doherty, NAMI Sussex, and Mental Health Board.
Good morning, I'm Peter Mancusi, Assistant Director with Children's System of Care.
Bill and Angie Malgiri, and Lisa's parents.
You guys did it for your friends?
No, we bring our friends.
Hi, I'm Robin Coley. I work for Collaborative Support Systems for the Passaic County Wellness Respite.
Assistant Prosecutor Maggie Syker with the Sussex County Prosecutor's Office. I run the Mental Health Diversion Program and the New Veterans Diversion Program out of Sussex County Prosecutor's Office.
Hi, Ingrid Bacabalaro, Regional Director for Family Intervention Services in Morrison, Sussex.
I'm Haley McCracken. I'm with Product Self-Sufficiency.
Hi, I'm Kathy Nada. I'm a therapeutic and educational consultant.
I'm Maria Smith, and I'm attorney, education advocate, and I'm also with NAMI.
Katie Mellon, reporter at the New Jersey Herald. So I'm recording what you guys are saying.
Hi, Nina Alexander, Division of Mental Health and Addiction Services, analyst for Sussex and Morris.
I'm Lori Risuto. I'm the Service Line Director for Behavioral Health for Atlantic Health Systems.
I'm Paul Burns. I'm Regional Coordinator for Crisis and Psychiatric Emergency Services.
Right.
Greg Hoff, Sussex County Administrator.
Lorraine Hens, Sussex County Senior Services.
Corinne Kaufer, Deputy Manager, Hardiston Township.
Brett Alamy, Hardiston Police.
Mark Senna, Hamburg Council Member.
David Costas, Sparta Library Director.
Will Porter, Sussex County Library Director.
Annette Hoffman, Intensive Family Support Services, and now in Sussex.
Lois Kinsicki, Intensive Family Support Services of Sussex.
Good morning, Cindy Armstrong, Division of Community and Youth Services.
I'm Roger Cherney, the Manager of Behavioral Health Services here at Newton Medical Center.
I'm Carrie Parmalee. I'm the Coordinator of Intensive Family Support Services of Sussex County and with the Mental Health Association of Essex and Morris.
I'm Beth Tully. I'm the Senior Wellness Clinician for Partial Care for Bridgeway Rehabilitation.
Okay, Thor?
Thor Carlson, Sussex County website guy.
Well, before I go on, we'll try to get you out at 10, but I have to thank everybody here for their good work. You know, it's been phenomenal work that's been done by all of you collectively and all of you individually. And so we have to thank you so much for your hard work. I'm going to introduce Roger Cherney next. Roger is the manager from, manager, right?
Yeah.
Okay.
Yeah, hi.
Thanks.
Yeah, I got to thank you again for all being here. A couple of housekeeping things. Please eat the food. A lot of pancakes left. There's a lot of stuff in the other room. Restrooms are down at the end of the hall to the left. What I wanted I was hoping to share some information, statistics briefly that I think, convey the importance of what we're doing here and the matters that we're addressing here collectively. Healthcare experts, including the Surgeon General, have identified mental illnesses as the foremost public health problem in the country. And mental illnesses are the leading cause of disability in this country. 1 in 5 people have a diagnosable mental illness. That's more than 65 million people. And in Sussex County, that translates to about 30,000 people here, 8,000 of whom are youth. The good news is that effective treatments for mental illnesses exist. Recovery from mental illness is not only possible, it's much more common than most people think, especially with adequate, timely intervention. Unfortunately, the social stigma around mental illness leads to shame, embarrassment, self-blame, isolation, hopelessness. So efforts to combat stigma go hand in hand with recovery. So thank you for, you're taking time out of your busy days to be here and recognize the importance of what we're doing here together. Thank you. I'd like to introduce Sylvia Patillo, who is the Deputy Director for the Board of Chosen Freeholders.
I wanted to just bring up the cookies. I ate one of mine, so I just wanted to make sure they were fine, and they are. So the students over at Botech made them, and they made the little label here that we have for today's forum. So please enjoy them, and I want to thank them for doing that. They do such a great job. I want to thank all of you for coming. And I would like to begin by thanking Newton Medical Center for the lovely accommodations and for Roger Cherney, the manager of Atlantic Behavioral Health, for arranging and planning such a delicious breakfast. I also would like to thank the students, and as I just mentioned, their cookies are delicious. A special thank you to the Mental Health Board and Carol Lavrit, who is the director of our Human Services Department, and all of our very dedicated staff that are with us today. This forum was organized to address the issue of mental health conditions and to acquaint you with the many services that we offer through our Human Services Department. If you browse through the contents of your information folder, which I'd like to take a minute to do, you'll notice that you have a directory, which is very important because all of the service and contact numbers are here. And if for some reason you have a situation that you don't know how to handle and you can't find a resource in this directory, you have a card in your book for Carol Lavrit. She should be your contact person for any help, any resource, and anything that you can't find. She'll be able to help you. And we ask that you please make that call. And once you make that call, the county will show up, and not only will they bring all the resources that they have with them, but they'll bring all the other vendors and 501Cs and resources that they have outside of the county itself. So there's a lot that we can help you with. And I want to thank, I know that the municipalities that are present today, there are many that wanted to come, were not able to come, and that's one of the reasons we have Thor. We'll be taping this so that we can send it out so that everybody can see it, even if they're not present here today. So I really want to thank all the different groups and people that came, that will be speaking, that have all the information and resources available, because although there aren't as many municipalities we had hoped, they will all be able to watch it, and they'll all get their booklets, and they'll all have the information as if they were sitting here this morning, which is very important. For those that are here, you have a little white sheet that you can take down and jot down your notes. You have the resolution that the county passed for the Change Direction campaign, and we're asking we have a little thing here, that the other municipalities would take an action and follow with us and pass the resolution as well. I know that Sparta, I think, was one of the first to do that. And here's something that's really very important. I was so glad when I saw this and they explained to me what they had done. This is how you approach. It's a list, a way of how you would approach someone that has a mental health condition. You don't want to be overpowering or sometimes you don't know what to say, so you don't say anything. You want to engage. And if you follow the sheet, it gives you great advice on how to engage someone and hopefully get them in a position where they'll go for help. So if you'll read through this, it's a very important step-by-step process that they outlined for you. And the last thing that's really important to us is there's an evaluation. Please fill it out truthfully, because we want to be able to continue to improve in how we present information to you. So please make sure you fill that out and just leave it on your table or pass it over to one of us at the end. Very grateful for all of that. I would like to say that our staff members are excellent. They're well-trained, they're compassionate people, and they want to help you identify the signs of mental health conditions. And they want to show you how to approach someone to offer help so that you can give them resources to ensure that the people that have a need will get the help that they need and that they deserve. Did you know that 1 in 5 adults experience a mental health condition every year? 1 in 17 lives with a serious mental health issue. And did you know that of the 74.5 million children in the United States, an estimated 17.1 million have or have had a psychiatric disorder? Children and adolescents with mental health conditions are at risk for academic failure, for substance abuse, and a clash with the juvenile justice system. But in spite of the magnitude of the problem, lack of awareness and stigma keep the majority of people from seeking the help that they need. Today we will talk about what it is like to struggle with mental health issues. We will learn about the 5 signs of mental conditions and the campaign to change direction to remove the stigma associated with emotional suffering. In order to be stigma-free, we have to change the culture surrounding mental health and wellness. And that is why your presence here is so important. Culture change will happen faster if leaders like all of you will step forward to set examples for others to follow. If you see someone you know, contact them, offer them help. If we are not afraid of the conversation and more open and more honest about mental health, we can begin to prevent emotional suffering. We can remove the stigma that is associated with mental health conditions and enable those in pain to get the help that they need. This morning, we want to make sure that all your questions are answered. So after the speaker portion of the program, we will stop for a question and answer period. If we didn't have time or there's something more private that you want to talk about, the staff will remain to answer any questions you might have after the program. So thank you again for coming. We're so glad you're here. And now I'd like to begin the program by introducing Cindy Armstrong, the Sussex County Mental Health Administrator.
We're going to start with a public service announcement about the Change Direction campaign. This is just one of several.
Guys, you guys see this?
What? Oh.
Guys, you guys see this?
What's going on?
I must have missed it. Oh, about Adam. Yeah, I saw that this morning. It's so sad.
Man, he used to hang out with us. Yeah, and then he just stopped. I hope he's gonna be okay. I wish we had noticed the signs and done something.
Fact is, 1 in 5 of us has a mental health condition, but emotional pain can be hard to spot and harder to talk about. Learn the 5 signs of emotional suffering: personality change, agitation, withdrawal, poor self-care, and hopelessness. If you see 1 or more of these signs in someone you care about, reach out,
Megan,
connect, and offer to help.
come sit with us.
Together, we can change the direction of mental health in America.
We were just talking about the literature exam and our answers for question 4.
Learn the signs and how to help. Visit changedirection.org.
So this is just
Man,
one
he
of
used to hang out with
several
us. Yeah, and then he just stopped.
on the Change Direction website. The Campaign to Change Direction is a national mental health initiative that was founded in 2013. This campaign, seeks to make the way we talk about mental health as common as the way we talk about physical health. This campaign is created through a common language that will remind everyone that our mental health, just like our physical health, is just part of being human. And this is one step in a way to just normalize it. You can find these videos and more on the under outreach tools. There are, let me scroll down. Let's try that again. There's lots of materials on this website. Some of them we can provide for you as well. Let's see if I can get it to go. Well, I don't think I'm going to be able to find it right now, but it is under this outreach tools. Okay, here we go. Okay, so where it says here, attention employees, videos to show in the workplace. So there's very short videos that you can watch and show in the workplace that will describe the 5 signs in someone that may be suffering from one of those conditions and how to talk to them as well. There's also information over here about mental CPR, so another free course just to get some more information about the program. This campaign can be used in conjunction with other messages such as the stigma-free zone, which many municipalities throughout the state have adopted, and Sparta in our own county. They are not meant to be used exclusively. So one other resource I want to show you is the county resource page, which thank you to Thor who put together. So on the back of all of the materials, the bookmarks and the handouts, and on the posters, the QR code, that QR code will take you directly to this county page. The website address is also there. So on this site, there's several links. This link takes you directly back to the Change Direction website for the article that was in the paper last year when our freeholders passed the resolution supporting the campaign. There's a copy of the resolution. This is a handout that's in your folder about Know the 5 Signs. This link takes you to local mental health resources, which some of them are in your folder as well. And then the last one is screening tool, mental health screening tools from the Mental Health Association. We will be adding more resources to that website as well. I just also want to take a minute to thank the Mental Health Task Force. We have been working together on this, coming up with a campaign and promoting this campaign for over a year. So it's so nice to finally have it come to fruition, and I really appreciate the task force for all their work in getting us to this point. And lastly, I just want to encourage you to encourage your municipality to pass a resolution supporting the Change Direction campaign. Once your community does pass a resolution, we have more banners we can offer to you, more bookmarks, more of the handouts, and we'd be happy to come to your community and meet with your town council to talk to them about it if they have more questions before they pass the resolution. Next, I'd just like to introduce Annalise Malgieri. She's already introduced herself. Thank you, Annalise.
Yeah, Dad's got the camera. Wow, there are more of you than I expected, and many of you experts, so bear with me. Good morning, and thank you all for coming today. I was born and raised in Sussex County, so I'm so excited to be at this absolutely necessary event. I will be telling you my story and speaking a little bit in regard to changedirection.org. I'd like to start by telling you a bit about myself. I'm 21 years old. I come from a very large Italian family. My favorite color is maroon. I have a mental illness, and I have always enjoyed school and learning. Wait, did you catch that? If you did, you're probably wondering why I casually just admitted to having a psychiatric condition amongst a list of my hobbies, likes, and dislikes. Could you imagine if it were this easy for everyone who is struggling with their mental health to admit it? Perhaps the percentage of people seeking help might increase. Perhaps the startling statistics regarding suicide might decrease. It hasn't always been this easy or casual for me to admit that I live with a mental illness. In fact, 4 years ago, I went to great lengths and told countless lies just to hide the chemical imbalance in my brain that was wreaking havoc on my life. Because at the time, I did not realize that it was just a chemical imbalance. and I knew others wouldn't either. So I lied. Imagine that, a once outgoing 17-year-old, straight-A student, athlete, vice president of her high school, leaving social gatherings early to go to therapy, coming in late to school because she had psychiatric appointments. What would people think? So I smiled half-hearted smiles, withdrew from my friends and teachers just enough so they knew something was wrong, but had no idea what, and only broke down in private places like bathrooms and empty parking lots. One day in school, there were whispers stirring regarding a sophomore boy who tried to hurt himself. Fortunately, he didn't succeed, but that wouldn't stop my classmates from voicing their opinions on the near tragedy. Some to the tune of, suicide is selfish, it's the coward's way out, and happiness is a choice. Remember when I asked what would people think? Well, now I knew. Although I wanted to, I couldn't blame my classmates and friends for the ignorance they possessed regarding mental illness. Mental illness wasn't something to be talked about. It was taboo. It was hush-hush. Unless they experienced some struggle themselves or were close with someone who did, the knowledge many people possess regarding mental illness is based in stereotypes, stigmas, and media portrayal, which is the exact reason many individuals, including my younger self, are or were too afraid to seek help. They're afraid of being stigmatized. I was afraid of being stigmatized. It took 5 clinical psychologists, 4 psychiatrists, and 1 overnight stay in the hospital for me to be accurately diagnosed. The doctor came into my hospital room, and I impatiently waited for her to tell me that I was totally and completely dying, there was no hope for recovery, and I was in fact insane. But she smiled endearingly and said, "Honey, you have OCD. That's it." And at that moment, I felt like laughing in her face, or cursing her out or crying. But at that point, I had cried so many tears, I was practically dehydrated. The amount of gray hair my parents had increased tenfold, and we were all simply exhausted. So we left the hospital with our tails between our knees and vowed to start the recovery process tomorrow. I didn't sleep that night. I was not happy with the answer they had given me at the hospital. How could so many doctors have gotten it wrong, and this lady seemed so confident? And not only that, but I didn't wash my hands obsessively or fix crooked picture frames, and to be honest, I kept my room sort of a mess, so how on earth could I have OCD? Putting our doubts aside, my parents sought out the best OCD specialist they could find. I think my parents were tired of their 17-year-old daughter sleeping on the floor of their bedroom because she was too afraid of being alone. So they put all their hope and a good chunk of money towards this therapist. And thank God they did, because I'm not sure I would be standing here today if it weren't for my parents and that therapist. I was in treatment for 3.5 years. In the beginning, I went to therapy twice a week and called that therapist incessantly in between, and saw a psychiatrist every other week. I was quickly using up our insurance, burning a hole in my parents' pockets, and my improvement was minimal in the first few months. I was disheartened. Something was standing in the way of me and recovery, and it didn't take long for my therapist to realize it. When she gave me worksheets, I wrote my name in pretty script in the top corner, followed by either a doodle of a heart or a smiley face. Regardless of the fact that I could have been sitting on her couch crying, I always added that stupid little doodle at the end of my name. One day, she very bluntly said to me, "Annalise, what's with the smiley face? You're not happy, so why on earth are you pretending to be? Stop doing that." And that's when I realized it was okay to not be okay. I stopped making up excuses for not following through on my treatment. I stopped lying to my friends about being in therapy, and I stopped being afraid of the label. I was embracing my mental illness, and that's truly when my recovery began. I learned all about obsessive-compulsive disorder through my cognitive behavioral therapy. I can proudly say that I am now an expert. I learned firsthand that controlling your thoughts is no easy feat, and that obsessions and compulsions can sometimes be so severe they are misinterpreted as delusions or other symptoms of psychosis, and that's exactly what I had been experiencing. Research says that the most effective treatment for most mental illnesses is a combination of cognitive behavioral therapy and medication. I can vouch for that. But finding the right dose of psychiatric medication that works well and has more benefits than side effects is not easy. In fact, I have tried 9 different medications in this process of finding my current successful medication. I'm so lucky to have found that successful medication, and I'm so lucky to have gone through that successful therapy. And I'm so lucky and proud to stand here today and tell you about it. But the thing is, not everybody is so lucky, and that's where you can help. It's time to change directions. I struggled in silence for months before telling anyone about it. What if someone had seen the signs and done something about it earlier? Perhaps I could have been led to those successful treatments sooner. Or perhaps it was someone else's story we interrupted by seeing signs and doing something about it. Maybe we could have saved their life. There are 5 signs that indicate when someone is struggling internally, and unfortunately these signs often slide under the radar. Is someone you love experiencing a personality change? Are they agitated or withdrawn? Are they demonstrating poor self-care and hopelessness? Look closely. If they are, reach out. And if you don't know how, that doesn't mean you shouldn't reach out. You can go to changedirections.org to learn. In June, I will be going to Ocean City to compete for the title of Miss New Jersey. And one of the most special things about being part of the Miss America organization is that each young woman has their own personal platform that they feel passionate enough about to promote throughout their year as a title holder. Mine is No Mind Left Behind, a mental health initiative I created and am proudly bringing to the Miss New Jersey stage, and hopefully the Miss America stage after that. So today I ask you to do 2 things: change directions and leave no mind left behind. I know that these are not simple requests. I get it. I understand that talking about mental health is hard. I used to literally be afraid to say the words, I have a mental illness. But it's possible. Look at me now. My name is Maryann. I'm 21 years old. I come from a very large Italian family. My favorite color is maroon, and I have a mental illness. Of introducing Kathy Nada with the Therapeutic and Educational.
So that's a tough act to follow. Annalise, that was really great.
Thank you.
I just wanted to thank the Freeholders today for having me, and Cindy Armstrong, the Mental Health Task Force, for working so hard to get this event started. I just moved recently, so I was cleaning out the house, and I found these papers. So there's no date on them. My daughter wrote them. I don't know how old she is. I would say elementary school. So I'll just read you a couple lines because it's the same thing over and over again. Why does it keep on happening? Why won't it stop? Because it keeps on happening, on and on and on. It's happening again. Why won't it stop? It keeps on happening, on and on and on. My daughter also has OCD and anxiety, and she was diagnosed at 7 years old. Living with someone with a mental health condition can sometimes feel like a freight train. It just rolls you down. And sometimes it can feel like the tapping of a pencil or the dripping of a faucet. So, you know, you hear it, I'm not gonna let that bother me. You hear it, the sound doesn't get any louder, but it's pervasive. It seeps into all aspects of your life, and you get to a point for yourself and your family member that you just can't take it anymore. The toll that it can take on that person and the family is extremely isolating, and it takes a toll physically, mentally, emotionally, socially, and financially. So financially, I was not able to work. For 10 years, I had to take my daughter to therapy appointments, psychiatry appointments, meetings with teachers, phone calls with teachers. I calculated I probably spent about 25 to 30 hours a week managing her care. An example of the cost of treatment, as a lot of families here can imagine, so picture 12 years of hospitals, psychiatrists, therapists, and schools. To give you an example, in the spring of her 6th grade year, we found an OCD specialist at NYU Hackensack. And I took her out of school 2 days a week for 3 months. So 2 days a week for 12 weeks. And that cost me $2,000 a week. And that was one spring of her 6th grade year. 7th and 8th grade, the specialist moved to New York City. So we went to, so picture now 2 years. Now I have 2 other children. 1 or 2 days a week, driving 2 hours each way to New York City. So that's 5 hours a day times 2 for 2 years, right? So you can imagine the cost of that. As well as I'm not home with my other 2 boys. I'm missing all their games. And what about my daughter, who's supposed to be in soccer and gymnastics and making friends, and none of that's happening for her. School, I mean, it's huge for these kids. The teachers, administrators, they really try to understand, but it's difficult for people to see when there's no visible handicap or illness, right? There's no wheelchair, oxygen tank, or cast to remind you of what this person is afflicted with every day. So she looks normal, right? She dresses normal, she's very smart, she's very articulate. She comes from a good family, half Italian. So, but you know, they see kids speaking out in class, disrespectful to teachers and other students, says inappropriate things, is always the victim of being bullied, and boy, she would give it right back. So I think they would look at me as, she must not be disciplining her enough. Boy, she's a spoiled brat. You know, she dresses nice. They must just let this go. And don't get me wrong. I mean, she was extremely challenging, and that was the understatement of the year. Okay, but she had such severe anxiety and OCD that she was just doing all she could do to get through the day. And sometimes it manifested itself in those ways. It morphs. It started with hand washing and obsessive showering, to asking questions all the time, seeking reassurance, laying with her in bed until she was 14, throwing away clothes and shoes she thought were dirty because we were in the city for her appointment, and so whatever she wore in the city was dirty. Refused to go to gymnastics that day because, you know, the mats were too dirty and she couldn't handle it that day. Isolation. And so you're exhausted and you're depressed a lot, and you can't always fake it, right? Some days you just can't fake it. Maybe you don't have the money to go out anymore because you're spending all your money on therapists. And sometimes when you can do it, she's having a bad day and you have to cancel your plans. And she doesn't have any friends by the end of 8th grade, so now I don't have any friends. And I don't have people that I can talk to and say, what's normal emotionally, academically, socially? Like what's her OCD, what's her personality? You know, you don't have those people to gauge that progress like you do with your other children. So picture this scenario. I think she was 8th grade, so 14 years old. We're at Rita's, and they're doing, I don't remember what the night's called, but the teachers all work there, and scoop the ice cream, right? So you get the schedule, so you always go when your child's teacher's there. So I take all the kids, and she doesn't want to get out of the car. Now, she's 14, mind you. She doesn't want to get out of the car because she doesn't want anybody to see her. So, okay, you know, sometimes you just don't want to fight it. So I take the other two in. So she decides to, now it's packed, okay? She's beeping the horn, has all the windows rolled down, screaming that I'm a terrible mother and she hates me. So, and, you know, and of course that's not the only time that that's happened. So that can be pretty isolating. Because when people see you and maybe they saw that incident, they're just afraid to talk to you because they don't understand. They don't know if maybe she's not doing well, so they don't want to ask. They're just afraid and they're not sure what's going on. Sports, soccer, she missed a lot of practices, so then she doesn't play in the game, then she doesn't make friends because she's not at practice enough, and then I don't tell the coach exactly why she's missing practices. I just say doctor's appointments because I don't want one more person to know. I don't want to have to tell one more person. Gymnastics, so she was in the hospital for some time, and when she came back, gymnastics is something she stuck with through 8th grade. And this was the hardest thing for me. She, the first day back, the whole team was doing a 5K. And so we came, and I was gonna run with her, and everybody had t-shirts, and we were gonna take a picture, and there was no t-shirt for her. Not one child or coach asked her to be in the picture. And I'll tell you, you know, I'm sorry, but if she had cancer, that run would have been for her, and she would have had a GoFundMe page. The major areas of need are pediatricians and school systems. They are the first stop for a parent like myself when you know your child is different. And they really need mandatory training to understand the different diagnoses of mental health conditions, how they can write better 504s and IEPs for different kinds of kids so they can thrive in different situations. I think Alex was very difficult to understand, and she was getting straight A's, so they thought, oh, we don't have to worry. You know, the social and emotional well-being, that her parents can handle that. So it has to be a community effort, like we're all trying to do here, communicating, working together to help our children. We may have limited resources, which we always hear, but in this room we have unlimited brain power. And I think if we can have more of these meetings, we can really find ways to make this work. At the end, the emotional toll in and out of the hospitals, had to leave the public school, had to leave an out-of-district placement, and had to go to a boarding school. So then you cringe when your friends talk about their high schoolers going to the prom, getting jobs, getting their driver's license, and you wonder, not only will your child ever experience those milestones, but if they're going to make their next birthday. So you spend your whole life, it's like crawling out of a hole, trying to get people to understand that she's not a bad kid, that she's just in tremendous pain. So you fight the big fights with the school districts, the mental health community, the insurance companies, and you fight the smaller daily fights with the bus drivers, the teachers, and one more mom because your kid said something inappropriate again. So, and then what's even harder is when your daughter's away and you meet people during that time period, they don't even know you have a daughter because they've never met her. She's been gone a long time, and when she was home, she didn't attend many events. But I'm here to tell you, people's perceptions have changed for the better. I've been, as you know, in this for 10 years. There's definitely better awareness and education. For example, through my work, I saw this movie about teenage anxiety called Angst. And I have a relationship with the Sparta Middle School principal, and he helped me get this movie out. He invited all Sussex County educators and health professionals, and we got about 100 people. And I thought it was really a great showing because it just was a different way to get at people. It was a movie, right? Not a presentation. And he also showed it to the 7th and 8th grade students at Sparta Middle School. And that is something that I'm going to work to try to get mandatory attendance for all schools in the county. We have a long way to go, but education and awareness is the answer. And this should never be a political issue, but an issue of humanity. We all have loved ones that suffer from a mental health condition. This campaign today will be amazing because it will increase the awareness and the talk about mental health on a daily basis. When people drive to work, when they bring their kids to practice, when they go out to dinner, they will see the signs along the road, and it'll make them think about what this campaign is about, and maybe let them think a little more that they need to be a little more educated. Thank you very much. And now I'd like to introduce Rita Smith.
Good morning. Thank you for having me. I appreciate the invitation. It's very personal to me. I think for, just to be transparent, I should say that I am also Italian. Right here. My child is only half Italian as well, so it's probably important that I tell you that, because it seems to be the trend now. It's also important that I let you know that I have a child that is not yet an adult. She's under the age of 18. So in order for me to come today and be able to speak to you, we had to have a family meeting because we had to discuss the fact that I was going to be talking to you about very sensitive, confidential information about our family and what our experience has been regarding the trajectory our family has taken. And we even sat in a therapeutic session to decide if this was something that was appropriate for us to discuss publicly with individuals who have the opportunity to really address what's going on and pass resolutions individually in their municipalities. And we all felt very strongly that this was something important and what could really come out of that. So I'm going to throw some numbers out at you. Don't worry, there's no math quiz at the end of this, but it tells a little bit about our story. 8 is the first number. This is the age that my child was when we started off on this really insane, crazy path of, and I'm using crazy very specifically so I can explain that word at the end of my presentation, that seems to have taken us in a very different road than we expected to go on. Because when you have a child, and I'm sure many of you have children in here, you have this vision of what your life is going to be like and what your child is going to experience, and you sit in classrooms with them and you meet their teachers. And when your path veers in a very different direction, it's very surprising where you're going. And 8 was the age that happened with my daughter. 2, she was in 2nd grade. This is the grade that my daughter needed to leave her public school system and attend a different school for the first time. This was also the grade and the age that she was when she started going through emergency rooms and needed to become an inpatient at the time. 3.5 years was the number of years that my daughter attended an intensive outpatient program. Many of those years were full-time programs, and for many of the time it was also part-time. So it would be part-time during the week and all day, every single Saturday, unable to attend any sort of enjoyable extracurricular activities. 84, the miles that we traveled round trip to the intensive outpatient program so we could have a quality program for her. 84 miles round trip, twice a day, 4 days a week, 5 days a week, sometimes 6 days a week if we had to do a Saturday. 2,000, that was the amount of money we had to spend every single month to pay after insurance and after the school participated their portion of what they owed for my daughter's services every single month in the outpatient program. 88, that's the distance that we travel, at least anywhere from 1 to 4 times a month now, to be able to receive care from a quality psychiatrist. 2, the number of top education attorneys that worked on my daughter's case in order for her to be able to be reintegrated into the public school system so that she could have proper supports and an appropriate individual education plan at that time. 25,127. That is the amount claimed in our last tax return in medical deductions, not including the over $12,000 we spent in pre-tax insurance premiums. We spend a lot of money every single year on her medical care, which is very necessary. None of these providers are in network. We have top insurance. We have some of the best insurance in the United States. And still, we have to spend that kind of money every single year. And it's not something that's going to go away. My daughter doesn't have a curable disease, per se. It's management all the time. So you could say it's the best return on an investment we've ever made, right? I mean, you're investing in your own child. If she had this amazing talent, you would send her to the best schools, and you would invest in the best voice teachers. Because we have a child like that too. She's really talented vocally, and she's an all-state choir child. This is a wonderful investment, and it's something we'll never stop doing. But I can tell you it's crippling. It's very, very crippling. It causes you to lose your home. It causes you to have to declare bankruptcy. It causes you to not be able to meet other needs. It causes you to not be able to vacation and not be able to pay your bills. That's what this sort of expense does to a family. It's very true. Children with mental health conditions are a full-time job. So if you work, or if you have anything else you're involved in, whether you're volunteering, you're working full-time regarding your child's mental health. Because you're traveling to doctors, you're speaking to specialists, you're managing their care. You probably have a behavioral plan at home. That's a lot of work to participate in a child's behavioral plan in your own home, because you have to make sure that you're really perfecting that, so that they have all the tools, so that they can become independent one day, because it's an investment that you're making in time well spent with them. So it's a full-time job. Every household member is affected. I see it all the time because of what I do professionally, but I can tell you that I watched my other daughter, who was only 11 at the time, develop tremendous anxiety regarding having a sister with a mental health condition. And I saw her become depressed at times. And now we're addressing somebody who has now what would be a mental health related condition, but was more related to what she was dealing with living in a home with a sister who had a pervasive mental health condition. Your circle of friends and family become very small because the ignorance surrounding it is so enormous. So how many people in our family, oh, there's nothing wrong with her. Oh, it's just she's not disciplined. Oh, nothing's going on with her. It's just because you got divorced years earlier. It's just because of this. It's just because of that. There couldn't possibly be a chemical imbalance with this child. You chalk it up to every ignorant reason possible. It doesn't matter that it's obvious that you're advantageous parents accessing every resource and every doctor available to you. They're going to blame you for it. So you have a very small circle. Schools, there are wonderful members and staff and personnel in the schools that want to work with you, but the system as a whole is not designed to address the needs of this population of students. Special education as a whole works on a deficit system. So whatever a child has, it could be a specific learning disability. In this case, it's a mental health condition. There's something wrong with the child. So if there's something wrong, we try to piece in the pieces that they need. The problem with mental health is that in the public schools, there is nothing to piece in. There's no services. There's no accommodations. We can only modify so much to address it. So when you put a child in the public school system that has a mental health condition, and one that requires a tremendous amount of supports and understanding, we have a lot of staff that doesn't understand it. We don't see it. Again, it's a very similar situation to what Kathy has explained. We don't see that in school. You don't have to see it. It's invisible, but it exists. And when the child steps off the bus at the end of the day, like mine did, her face went, you watch the face twist, and that's when everything would explode, because just because a child has a mental health condition doesn't mean that they're not capable of understanding what is socially appropriate behavior in school and maintaining that to get through the day. And then they totally decompensate when they get home, and that's where the nightmare begins for many of them. And that's regular. So what I did personally, that's our family's experience, as much as I can possibly share, and we agreed to share. But I can tell you that I used my experience to benefit others. Because if my family lived in this chaos and crisis, and we accessed everything that was available to us, I promise you, we reached into everything. I decided to make it my mission to help other people. So I worked with the attorneys that I knew, and I talked to all the advocates, and I talked to the specialists, and I made it my mission to become a non-attorney education advocate, because I saw the deficit in the schools, and I saw the neglect, and I actually saw the violation of children's civil rights when I walked into the schools. So my clients are children who are either classified, non-classified. It really didn't matter. They were children who were struggling, and I wanted families to realize that the stigma that was attached to the children, because this is my heart, these are my favorite clients that I take on, are the kids with any sort of behavioral disability, essentially, that they're not alone. So it's not just assisting the families with putting an education plan together for them, but it's also connecting them with all of the wonderful services in the county, because there are more services than people realize. There are more organizations that they're able to be connected with, and families live so quietly in this terrible crises, and they don't want to reach out, and they don't want to ask for help because they're going to be stigmatized if they say there's something wrong. So they don't know who to carefully connect with, because then they may be exposed, and it's going to be raw, and they're going to be spoken about, and they're already dealing with opposition with trying to get services, say, in their schools, because they think that's where they're supposed to go, or they're working with a pediatrician who doesn't know how to connect them with the services that they need. So we go in and we try to connect them with other programs so that it's not all punitive treatment, and see what kind of services that we can bring in for them. One of the things that I've seen is that, and Kathy touched on this a bit, is I've had friends with the really absolute misfortune of having children diagnosed with cancer. And I've stood outside the Walmart selling cookies with them. And we've organized walks, and I've walked with them with our shirts on and whatnot. And we've raised money for their family to be able to go, drive to their treatments, and for them to be able to, somebody got a car because they needed the transportation. And we've organized those things. I have a close friend whose son is transgender, and the treatment wasn't being covered by insurance. So they had a whole fundraiser for that, and I participated in that. And that was very personal, because we've seen this child blossom tremendously, and he's so confident now and comfortable, and he's making changes in his public school. But nobody ever had a fundraiser for my daughter. And all the years that I've gone through this, which is 6 years now, somebody gave me a gas card once when I was traveling really far. Now, I never asked anybody to give me anything. I'm not going to be honest with you. And if you go through one of the systems, you're lucky if you get a respite, because those are very hard to come by. But who do you ask for that from? Like, who's going to offer you assistance? Who's going to do a fundraiser for you? Hey, my kid has a mental health condition. Let's go on a walk together. No, because I'll be honest with you, your kids can't go into school and they can't say anything, because you know who they're going to be labeled as? They're the next school shooter. That's the new thing that happens if your child has a problem. Because you hear everybody here, you haven't seen adults all say to whether, oh my gosh, Mother Nature must be bipolar. Or that's a crazy cat lady. There's that crazy word. The verbiage we use every day is so stigmatizing. It's so stigmatizing. We talked for years about not calling people gay. And it is, it's a terrible thing to be saying. We don't want to use those words with a negative, and imply a negative connotation to them, but we do it all the time with anything that's mental health related. So right now, on the wake and on the heels of school shootings, and honestly, if you look at the numbers, the risks are not nearly as high as we like to make them out to be. I think they could grow in time based on what I see in schools, but I will tell you, you can't ever have a child go into school. So here I am talking to you about a child who sits in a public school system in a middle school every day, and she can't possibly say anything because the school staff is afraid to even talk about it to me, and they know what I do for a living. So this campaign is so critically important, and I ask you to please take it very seriously. Take it back to your townships and your municipalities, and I'm glad that everybody will be able to participate, because it means so much that we should start being able to talk about mental health. With our youth, it's so critically important. One of the things that's very personal to me, and I'm going to plug it because it is very personal to me, is the Ending the Silence program that's being introduced by NAMI in the fall, because we're going to be able to bring these conversations and these experiences into the public schools. So all the public schools in Sussex County will have the opportunity to be able to, we can reach the children directly, and we can talk about mental health, and they'll have the opportunity to be able to start recognizing things and being able to learn where they can reach out, where are those outlets. Because some of them might not have a mental health condition, but they're living with an adult who does. So it's really busting that stigma, and it's talking about how we can make some changes and what we can do, and addressing it. So I appreciate all of you being here today and hearing my story, and being sensitive to the fact that I have a little girl who lives with this, what really is a nightmare for a family, but learning to be competent and capable and address the fact that this is not some life sentence. This would be just like if you had diabetes and you had to manage it for the rest of your life. It's a medically based, biologically based condition. So I appreciate very much you listening to my story. Thank you. Oh. And I have to introduce the next speaker. And Paul, I'm sorry. Does anybody have any questions? I apologize. I don't know what you could possibly ask me, but I'm happy to answer. Does anybody have any questions? Yes.
So you talked about somewhat infiltrating the school system, right?
Mm-hmm.
Have you been, or are you going to any school systems right now to talk
Yes.
to them?
Well, I go in as a non-attorney education advocate. So I have clients with mental health conditions right now in public school systems.
So they'd have to approach you first. You'd have to have a client approach you. You'd go to that school
Yes,
system.
I actually have people reach out to me constantly because I ran a parent education group for a long time, which I still run. So people would come to me, and then I have a lot of other people that come to me. I'll be honest with you, a great majority of the people that reach out to me are teachers and staff in schools. I've had teachers come to me and say, I have a student, that, and they have to be very cautious. So they confidentially come to me and say, I have a student in my class who's self-harming in the classroom. I have a student who's doing this. I have a student who's telling me this about their parent. I cannot approach people. I mean, that's just not ethical for me to do. It's a challenge. It's a real challenge. But I see the inability for them to address it. There's more that's accessible to them now for the schools, but the schools are not always connecting. So it's a lot of conversation. A lot of times it's not intentional. They don't want to not help the student. They're just not aware of what services are available to them. So a lot of this is really getting the information out there and connecting and connecting and connecting. And that's what I try to do, is I take a little bit of a different approach. I take an educational approach as well as an advocate approach. So because I want the parents to be able to, if a child has a mental health condition, the parents have to do this for a long time. This isn't me coming in and correcting a problem and walking away. It's long term. So they have to be able to do this in my absence. This is about becoming a good advocate for your child independently of anyone else.
And teaching the parent as well how to do that.
Yes, yeah. So, I mean, that's not necessarily my job, but I'll connect them with other people to do that. But I try to get them off on the right foot. And a lot of that is resource and referral. But I'll secure a proper plan for them, hopefully, up front. And there's many means by which to do that.
It's amazing.
We try. We try. Yes, okay. Paul Burns, you're next. Sorry. He is the, I got to read it off of here, Regional Coordinator for Crisis and Psychiatric Emergency Services at Atlantic Health Systems.
Thank you for the invitation to be here today. Those are some incredibly powerful stories. Thank you so much for sharing them. You're a constant reminder, even to professionals who've been doing this for a while and feel like we're doing this with the right intention. It's a reminder of the humanity that's behind what's going on. And we need to hear that. So thank you for that. I kind of feel in my placement in the order, I'm kind of like, well, what's next? After you realize, you look at these signs, you look at what's going on in your life, and you realize, wow, there's something really wrong. I'm not really sure what to do next. Like, where do I go for help? When, if you know, well, I need a therapist, okay, there's lots of numbers to call. We have an access even for Atlantic Health to call if you know that's what you need. But you may not always know what you need. And where do you go to process what's happening? My life may be in shambles, or I'm not feeling good. and it's hard to identify. So I'm inviting the community to reach out to the psychiatric emergency services before it becomes a crisis. Over the years, when when screening centers were designated back in 1989, the idea was to be that resource in the community, to be out in the community. We were supposed to be outreach. Because of resources for the screening centers, we ended up getting locked up ourselves in emergency rooms, so everybody had to funnel into us. Over the last couple of years, in partnership with the division, we've managed our funding so that we have outreach individuals, have outreach clinicians that are able to go out in the community, and we don't have to wait for it to be a crisis. The number one complaint that I get from families is, why do I have to wait until they have the knife in their hand before I can call you? So I'm here to change that. You got some incredible resources here. This sheet is incredibly useful. The 5 signs, these things, you see this, you're having this conversation with somebody, you can call us. If you don't already have a therapist or somebody that you don't have a resource already, you can contact us. We're here to help you process it, to help you manage it. We might encourage you to receive an outreach for yourself or for your loved one, where we can come out in the community. We don't have to wait for it to be a crisis. We are trying to get away from that, where we had to wait until it was a crisis. We still do that. We still provide 24/7 crisis outreach to the community for somebody that is suicidal or a danger to themselves or others, and possibly due to mental illness. And we are still, that's still 24/7. What I have during business hours is I have 2 clinicians who can do scheduled outreaches for somebody that, like, these warning signs are happening. These signs are happening, but it's not at a crisis yet. And we can manage it a little more differently. I can schedule some time. We may not even need to bring the police with us if we can ascertain that there's enough safety, you know, in the home that we can go out there safely. And that's really the only reason why we do bring the police, and that's a deterrent for most families to call us, because they don't want the officer showing up in their neighborhood. That becomes stigmatizing. Oh, they had the police show up. So if we can find that fine line before it's a crisis, so that safety is not an issue, then I don't necessarily need to have a police officer come with me. So, you know, and this is primarily for adults. For children, we do have the Children's System of Care, Perform Care. At the bottom of the sheet, I did notice that their number was on there. They have mobile response, and they would do that for children. Because I know most of the stories seem to be geared around children, which thankfully we are getting a little better at identifying these things earlier to intervene earlier. We're in the right direction. We're not where we would hope to need to be, but at least we're moving in that direction. So again, please consider us prior to the crisis. You don't have to wait until then. They said I only have 5 minutes. I'd rather give you the dissertation on screening.
I just want to say, can people just call you and ask you questions?
Yes. Okay, I'm sorry if I wasn't clear about that. So that's what I was saying before, that you don't have to wait for a crisis to call the hotline and say, these things are going on, what do you think I should do? You know, I have professional certified screeners. You got a little brochure in the packet to call us to process what's going on. It may not need to be an outreach. You may not actually need our service, but at least it's a connection point that you have. Maybe not. They don't always know to call the county services. You know, the hotline. We tend to have a little bit more exposure because we market it and we put it out there. So it might be the number that you remember. It's a very easy number to remember because it's the area code 383 in the area code. I'm sorry, you had a question?
Yeah, I have a question. I'm a resident of Franklin. I'm also the community organizer there. Part of what I do is connecting with people to talk about what opportunities or improvements we have for Franklin. And a lot of people face economic disparities in Franklin, a lot. And so I think in general, people don't reach out for help because they say, I don't have money for help. So if something that you're talking about right now, say you come out to their homes, is that something that is free? Like what happens with that
We do
part?
not charge for outreach. There's no bill associated with an outreach from our staff. We are one of the last agencies in the state that's not fee for service. We are still a grant funded service. Hotline doesn't cost you anything, the outreach doesn't cost anything.
I think that's huge, that part, to let people know about that part, because not everyone comes from a background where they have even insurance, so.
We provide a very finite service. We're there to assess and link and refer. You know, the other services that we refer to, they may still have those same issues in trying to get financing and so on. We can guide them to the agencies that would help them with finance, but you know, we don't necessarily have free services to connect them to. But our service and that outreach is, there's no billing. We've invited police departments, and I was at a meeting a couple of weeks ago with Tech around school safety and law enforcement. And I invited the police chiefs at that meeting that, again, A, they don't have to wait for a crisis to reach out. Or if they go to somebody's home, where they're repeatedly going out to somebody's home because there's a mental health issue, they go there, everything seems fine, but you know, the family is struggling, everybody knows that there's something going on and that it could be a crisis in the near future. I've invited the police departments to reach out to us so that we have the opportunity to at least call them. We're not necessarily going to force ourselves into folks' home, but we'll at least call and say, hey, we understand the police were out there, what's going on, can we offer any assistance? Or that if they go out and they felt like the scene was safe enough that they could leave it as is, they could still call us and we can go back out there with them, because they weren't sure. And that's like the screening law gave the police officers the ability to take somebody into custody if they see a mental illness and they see that it's potentially or is resulting in dangerous to self-owned property. And that they didn't have to arrest them anymore. That was a landmark decision made in 1989. But now we're saying, you don't even have to, like, it doesn't have to be that bad. We can still provide a resource for them and go out with them. And then we can make the determination, you know what, this needs a little bit more intervention. We need them to come back to the emergency room. And we can authorize police to provide that transportation if the person's not willing to come back. I'm sorry, go ahead.
No, I was going to help you out to give you an example of how great this service is. First of all, my name is Lois. My daughter is 31 years old and she suffers from schizoaffective disorder. I knew about this service for a very long time. And a bad example I'm going to give you first, and then I'm going to give you the good example. 3 months ago, my daughter started having some psychotic behavior. I should have called the service and had them go out and screen her and take her to the hospital. But what I did was, I didn't do that because I said, the police will have to come. She lives in her apartment. The neighbors know her. If a police car goes there, what are they going to think of her? There's no way I am calling the service and I'm having the police come. So I tried to handle the situation myself. I went over it. I tried to talk to her. You cannot reason with someone that is in a psychotic state. Unfortunately, it ended up in a violent situation where she actually attacked me. If my other daughter wasn't there to help me, I don't even know if I'd be here to be talking about this. So she went to the hospital, and I learned my lesson and said, if this ever occurs again, I'm going to protect myself, and I'm going to let the professionals take care of it. Well, unfortunately, last Monday, my daughter called me again and said, something's not right. This time she knew it, she felt it. She said, Mom, I need to go back to the hospital. She says, I'm not feeling good, I'm getting those voices again. I want to harm someone, but I don't want to harm someone. She said, so please, she said, come over here now and help me. And I said, my husband grabbed his keys, he says, let's go there. I said, we are not going there. We're calling The services at Newton, along with IFSS, they helped me along, got the ball going. They went over. My daughter said the police did come, but she was very calm. They took care of everything, and I stayed completely out of it with anxiety at home, wondering what's going on, you know. I got the phone call then from the crisis intervention. Jane called me and said, we have your daughter here. She's safe, everybody's safe, and it was handled properly. So I thank you so much for the services, because she can get very violent, and I think with the professionals handling it, she tend to be a little bit more calmer, and you know, me not being in that situation with her made me feel safer, and my husband. And then of course we went to see her that evening, and she's actually getting discharged from the hospital today. So I just want to put a plug in for Newton and say thank you.
Okay, Sylvia is coming back up with closing remarks. Thank you for your time.
I'll tell you, listen to the stories, and you just feel so helpless in being able to help them. And this forum is for the purpose to let you know that you're not helpless. The people that are dealing with it are not helpless. The people that are compassionate towards them and don't know what to do are not helpless. Okay, there is help available. And if you don't have the finances, or if you don't know where to go or what resources we have, once again, I'm going to say call Carol Nalbert. She will get you on the right path, and she will get you the help that you need. I'd like to say that my son suffered from depression for 14 years. I know what it's like when you have a child, you don't know what's wrong with him. From one moment he was fine, and the next minute he fell into a deep depression. His was from a mental issue that took quite a few years to actually diagnose. But I remember, you know, as Annalise was saying, that she slept on the floor of her mother's bedroom. I slept outside in my son's bedroom because I was afraid he would kill himself. He would walk out the door and I didn't know if he was coming home. And I know the fear and anxiety that he felt, I was beginning to develop that same fear and that anxiety. It affects everybody. It affects your family. It affects your social life. I would go out and I'd be thinking, where's Michael, where's Michael, where's Michael? I'm trying to talk or trying to give a speech, and my whole mind is distracted by where is my son. And the people that may be a neighbor of yours, you may not realize what they're going through. So it's not just the child that's suffering, it's the adult that's suffering, if the parents are suffering, and it's a bigger problem than we even realize. And having people feel free to come out and to share any part of their story is difficult at best. But we need to hear those stories. And Annalise, I mean, beautiful young girl, and we're going to be looking for you to be our next Miss America, so we'll be behind you. And all the other speakers that came up that are having their own difficult times in their own ways with their own families, our hearts and our compassion is with you also. And for the people that are here, you're our hope. The people, the municipalities, our police. I want to say something about the police. I had a situation one time when I was mayor of Apacon. A man walked in and he looked dazed. And when I went up to him, I introduced myself. I said, can I help you? And he said, I'm going to commit suicide. I'm going to kill myself. And I looked at him and I said, not today. And I sat him down and I called one of our officers in. And I know that we look at our police as enforcers, but there's so much more. There is a compassionate side to our police that you really don't see until you put them into that position where that compassion is needed. And my officer came in and sat down with this person and just spoke to him so kindly and gave him so much encouragement and assurance that we were going to help him, and got him into a facility where he did receive the help. I couldn't have done it without that officer. I didn't have the background, I didn't have the knowledge. Truthfully, the man scared the life out of me because I didn't know what to expect from him. But those professionals are there. Use your professionals. Use them in your town, use your municipality, use them in the county. And as I said, if you don't have resources, the resources with the county will not cost you anything. They're free. We're here to help. So today is the call. The call is for all of us to begin to really watch and listen and become aware of who is around you and the needs that they have. A kind word, a kind gesture, the approach to a conversation, the help that you'll give, and maybe even stay with them as you walk them through some of these things is very important. It's important to humanity. It's important to our community. It's important to those families that are in such dire need. So I want to thank you for coming. I hope you have all the information. I hope you go through it. I hope you share it. Again, if you need help, we're here for you. And the last thing I want to say that we forgot to say is that Freeholder George Graham was a large part of this forum, and unfortunately it was an emergency and he couldn't come today. So he just wanted to, wish everybody the best and say that he too is tuned into all of this. So the more that we work together, and the more that we spread the word, and the more that we try to change that stigma that is associated with mental conditions, we change our language, we change our stigma, and we become compassionate people to everyone around us, and we'll change the world. Because this is a worldwide movement. It's all over the world. It's not just the United States. It's in the UK. It's going into our military. It's going to all different aspects of our population worldwide, because they see the need to move that stigma out of the way and give people the help so that they can live a productive life. And that's what this forum was about, and we're so glad that you're here. And a big thanks to our speakers. We couldn't have done it without you. And a grateful thanks to all of the people that are involved in helping people with mental conditions. They are the most compassionate, loving, kind-hearted people that I have ever worked with, and I'm proud of all of them. And thank you again for coming.